Welcome to another episode of A Conversation with Villa Springfield. I'm Michelle Hemphill, Marketing Director at Villa, and today I'm excited. I am with Joy Rogers, who is Executive Director of the Community Health Foundation.
Correct.
So tell us a little bit about yourself, Joy.
All right. Thanks, Michelle, and thanks for this opportunity.
Sure.
And all the good Villa does in our community.
Thank you.
So I've been with Community Health Foundation since 2012, and we are a nonprofit organization. We are the last surviving entity of Community Hospital, and we have a couple of functions in the community. One being a clinical side. When the two hospitals merged, Mercy and Community, one of the concerns was that services that were available prior to the merger would not be available after the merger.
Right.
So on the clinical side, we provide reproductive services in our healthcare pavilion, which is directly adjacent to the hospital. So it's a seamless process for the patient, and we do not charge a hospital nor an administrative fee for that service. We, along with Mercy Health, are the co-owners of Community Mercy Health Partners. And that is the organization that was formed with the merger of the two hospital systems. So that function is to oversee, to a degree, the work of the two hospitals, Springfield Regional Medical Center in Springfield and the Urbana Hospital as part of Mercy Health in Urbana. We are not a controlling interest in that partnership. We don't receive any financial gains in that partnership, but we do provide a local perspective on the community's health and work with the hospital to improve the health and wellness of the community.
And you offer, like you said, services that the hospital, being under the umbrella of the Catholic organization, cannot do.
Correct. And only a limited amount of
Sure.
services, those being tubal ligation
Right.
and long-acting contraceptive shots.
So, I mean, that's a big deal for people.
It is, and we didn't want people in our community who were able to get those services at Community Hospital prior to the merger to have to go beyond the community.
That's right.
So it's keeping the healthcare local, it's providing a service that was available pre-merger, post-merger, and it's doing it again in a seamless way for the patient.
Right, they would not really know the difference, I wouldn't think.
Typically not, correct.
Right,
So,
if they weren't familiar with it.
right.
But after the millions of people watching us, everybody's going to know.
That's right. The secret's out.
That's right. So tell us a little bit about what community assets or what you do for the community. I know you do a guide, which is fabulous. We all use it. And a couple of different things with kids and all sorts of stuff.
Oh, exactly. Yeah, we are, you mentioned the guide, and
Yep.
I have one here because since this is a video, we can have visuals.
Yes, yes.
This is our health resource guide, which is for families of Clark and Champaign County, and it provides health information as well as daily living information. We publish this every other year. It's distributed free to whomever wants one. Individuals request copies, but also a lot of social service agencies use it, the police, the fire department, churches, businesses, health providers, just anyone who wants to have a resource available for their clients, for their patients, for their parishioners,
Right.
to have ready access to information on
Well,
health and
it is
wellness.
the handiest book. It lists everyone,
We
everything.
try to.
You really
You know,
do.
it's kind of a telephone book for health and wellness in our community.
Right.
And it initially started as a guide aimed at women, but we've expanded it in the last few editions to be a comprehensive guide for families, you know, men, women, children.
Sure.
So that's an important part of our outreach. It's not inexpensive to produce that, but I think it's a very valuable resource that we can provide the community.
Oh, I agree.
Yeah.
Yeah, especially for people who don't have a smartphone or don't have access to internet or a computer or something, you know, because everybody just Googles everything. The nice thing about the guide is it's separated to your needs, plus it gives you a little bit about whatever you're looking up to make sure you're on the right track of what you're looking
Right.
up.
Yeah, we try to give a few little facts on each
Yes.
section that kind of gives some general information, and then you can find more comprehensive listings throughout the guide. We also have our My Place, which are really cute.
They're
And these
great.
are to try to encourage healthy portions for your kids.
Mhm.
It has a spot for fruit, spot for vegetables, protein, your grains, and of course your dairy. And we offer this in a Spanish version as well. And we provide that free of charge also at health fairs, at the farmer's market, whenever we're out and about. With the coronavirus pandemic, of course, those opportunities haven't been as plentiful lately.
Right.
But wherever we are in the future, My Place will be available. So
That's great.
that's a good service too. In about 2015, our board decided to become a grant-making organization. And so we reach out to nonprofits in our community working in the area of health and wellness and provide grants to them. Since that time, we've provided over $1.1 million in funding to 52 different organizations. These
Wow.
organizations are focused on healthy living, safety net services, mental health and substance abuse abatement, as well as reproductive health. So it's a broad range of community health priorities. We follow the health assessment guidelines. You know, every few years, our Clark County Combined Health District, along with other health organizations in the community, focus on a new health assessment to see exactly the status of our community's health, as well as prioritize where programs
might
and
be.
funding should
Mhm.
be moving in the future. So we align our grant-making priorities with those guidelines in order to provide the greatest impact on the health and wellness of the community.
That's wonderful. And the grants, are they mostly in Clark County, Clark and
They
Champaign
are
County?
both Clark and Champaign County. Yeah,
both.
that is our service area.
Mhm.
We align our service area with the service areas that the hospital serves. So it's Clark and Champaign County.
That's great. Is there a certain time frame that you take applications for those grants, or is that year-round if somebody
Well,
would have something?
Typically, the grant application is available on our website in the fall,
Okay.
October timeframe. We'll have some grant information sessions for those nonprofits who wish to apply and want more information. They can attend a
Mhm.
grant information session. Those will also be late November, early December, and then
Okay.
the grants are due around the end of January. The exact dates are available on our website.
That's great. And at the end, we'll have the website, phone number, all the information you need for people to reference if they are interested in applying for a grant.
Okay, great, thank you.
Sure. Let's talk about the Expo. You guys do a family expo every year. That is fantastic. I always am a part of it, and it's amazing the amount of people that come. Plus, it's amazing how many free health screenings that you offer at that. And we don't have that now. You know.
Yeah, it's, thanks, Michelle.
Sure.
That is one of our most popular events, as you
Yes.
indicated, and it's just a delightful event for everyone in the community
Mhm.
because it is something that's of value, and we are providing free health screenings. And there's also over 60 exhibitors who are providing health and wellness information and helping people lead healthier lives.
Mhm.
We'll have stage demonstrations, and there's a lot of energy and excitement in the room, and as you indicated, usually more than 500 people attend that event.
Right.
Unfortunately, again,
Yeah.
due to the coronavirus pandemic, this year's event, which was in early October, has been canceled. We are moving ahead with next year's, planning for next year's event, and we always have it the first Tuesday of October, so if people want to plan way ahead, they can get that on their calendar.
Yes.
But we are looking to fill a little bit of that void. We know what a valuable resource that is, and we're very sorry to not be able to provide it this year, but of course, we wanted to be sure we weren't endangering both the guests as well as our exhibitors. So, but we are starting a new program, I guess, called Break for Health. And not like put on the break, but take a break. So, and it's going to be a virtual providing program, which will be
Oh, that's great.
a panel of speakers who are expert on a various health topic,
Mhm.
who will be just talking about, for instance, breast health or everyday wellness, health equity, just how to have a healthier family, how to cook healthier.
Right.
how to shop at the grocery in a healthy manner, stick to the perimeter, stay out of those processed food aisles.
It's difficult.
Oh, I know it. I laughed because I picked up a few things yesterday, including some potato chips, along with grapes, and, there was a mix. But,
you have balance.
That's right. But, try to help people learn how to try to be healthier.
It's hard.
And, you take small steps every day, and it adds
Right.
up to...
Well, it's hard to eat healthy, and sometimes it's expensive. It's pricier
Yeah, like the
to
fresh
purchase
fruit.
fresh.
Yeah,
Mhm.
you're right. And that's, again, where if you try to buy things when they're in season, your
Mhm.
costs aren't as high as trying to buy strawberries in the winter or something.
Right.
So
Yeah.
there's, little tips that perhaps we can provide for people to shop healthier and eat healthier.
Well, and I think all of us could learn
Oh,
from that.
for sure.
I'm not very good at it. I've been doing grocery shopping online, which has helped because you'll have that impulse buy.
Right, that's a good point.
But sometimes my items are teeny tiny or huge. I don't.
Well, yeah, we laughed. My dental hygienist and I were laughing. We're like, who really wants a teenage boy to be picking out your produce? And,
That's right. We're giving a lot of faith in. Maybe he's learning. Who knows?
That's right. So, Break for Health is going to be, a new venture for us, and I think it will help fill the void of not having the Health Expo. And of course, next year we'll have the Health Expo again, and we might continue both. We'll see how Break for Health goes.
Well, and if the Break for Health is up all the time, that's something, a resource people can go back to and get it updated.
At your own time, at
Sure.
your leisure, and you can access it, and if you want to skip through some parts, you can.
Right,
So,
right.
We hope it will provide just another resource for our community.
Right. At the Expo, we always offered flu shots.
Right.
And I have not talked to anybody yet this year about how they're approaching that, or if they're letting the physician's offices do it, or Kroger's, or have you heard anything about flu shot clinics or anything like
I
that?
haven't yet, and it is getting to be that time.
It is, yes.
I do know that I did see a sign at Kroger yesterday.
Okay.
So
Well, that's
so
what
they
I'm
are starting
wondering.
to pop up as far as with the signage and
Yes.
starting to advertise and promote this. Another thing that our Community Health Foundation does is, since you mentioned flu vaccines, is we do provide funding to Rocking Horse every year for their flu vaccine program.
Yes.
Which reaches out to the underserved and to the uninsured, and last year it provided 700 flu shots for people in need. So that's
Right.
something else that's important in our community. We are a strong supporter of Rocking Horse. They do so much good as a federally qualified health center, and
Yeah,
they're providing
fantastic.
a great need that's not being met. And for instance, their dental clinic, which opened a few years ago.
Mhm.
Most dentists in our area do not take Medicaid patients, so there was just this huge untapped
Void, yeah. Mhm.
dental care, and so that clinic has been just a great asset, and our organization's happy to help fund them as well.
Yes, thank you from the community, because the little kiddos, they're the ones you need to get used to going to the dentist and have the opportunity to do it, and a lot of them hadn't until Rocking Horse opened up.
Oh, I agree.
Mhm.
And nowadays, it's different from maybe when we were younger. They're advising parents to take their 1-year-old to the dentist.
Really?
To get them
Yeah.
used to it, and they just, rub their gums and
Sure.
what teeth there are, and so it's starting that experience at a much younger age.
And that's great, because everything's a habit once you get used to it. And unfortunately, some people just can't afford to go and don't have the insurance, or like you said, they don't take the Medicaid. So
Right.
Rocking Horse is filling a good void there. So the other thing that you do, you always have an annual meeting
We do.
with great speakers, keynote speakers. I love attending.
It's such a fun event. It
It
really
is.
is. And I think it's aptly named CHS Celebrate.
Yes,
Because it is a celebration. It's a celebration of our community. It's a celebration of the organization. It's a celebration of trying to be more healthy
Mhm.
and more well. And we always have both an entertaining as well as a motivating speaker who is speaking on a health-related topic in a humorous fashion. So it's a great event, and unfortunately,
Right.
we had postponed it,
Yes.
from April to September, but just recently postponed it again. So it's going to be March the 24th of 2021.
Oh, great.
And, you know, we're looking forward to it, and we'll be selling, for those who've already, there are some people who've already purchased tickets, you know,
Right.
for the April that moved to
Yes.
September. So those tickets are valid for the March 24th date.
That's great.
And then we'll be selling additional tickets come January 2021. Our speaker is Ron Culberson. He'll be speaking to Do It Well, Make It Fun, the key to success in life, death, and almost everything in between. So that about covers it.
Right,
So
sure does.
it's always entertaining, and we try to keep it short and sweet also. We have great food, great entertainment, and we get you in and out of there in an hour and a half.
Yeah, it's a great atmosphere, and it sells out. So if you're thinking about it, you need to get your tickets, because they go fast.
They do go fast, and we're happy to provide that to the community at a discount. There is an admission fee for that, but
Yeah.
our events are free.
Right.
But it is provided at a discounted rate. So anyone who wants to attend can.
Yes. Now, you are a foundation.
We are.
You take
We
donations.
do indeed.
How would somebody go about doing that? Would they call the office or
They
the
can do
the
that. They
website?
can look at our website.
Mhm.
There's a vehicle to donate to our website. We welcome all donations,
Absolutely.
obviously, and they help us provide these things for our community. So, yes, we're a charitable 501c3, and your donations are tax deductible to the fullest extent. And they support what we do.
And they support our community.
Right.
Park and Champaign.
Your dollars
and
stay
Stay
here.
right here in town.
And are helping promote the health and wellness of your community.
Well, Joy, I appreciate it immensely. Thanks for all the good work you're doing.
Well, thank you.
And I look forward to the celebration, hopefully in March 2021. That'll be here before we know it. I can't believe it's September
I
already.
know, it is hard to believe.
It is. I feel like we've been in a box, which we kind of have. Unfortunately.
We're trying to get out.
Yes, yes, help us. But I'm hoping 2021 will be bigger and better than before. I think we've all learned, I know I have learned to be more patient and to not rush through things and take things for granted as I did before. I think I just was always so busy being busy that you didn't pay attention, and now that you're not as busy because really there's, you know, up until recently there's nowhere to go. If anything good comes out of the pandemic, I think that's it. And hopefully people will understand a little more about what our community nonprofits are doing for our community, because people are reaching out more than ever now.
I think you're right, and you're so right too on the patience virtue that we've all been learning. And,
Right.
And I think people have stopped to some degree and started reevaluating a little bit what is most important to them and to their
Right.
families. And I hope health and wellness kind of bubbles to the top.
I do too.
I mean,
do
there's
too.
definitely a renewed focus, unfortunately due to the pandemic, but also, you know, I think people are realizing that life can be short and that they should take care of themselves and their loved ones.
That's right.
As well as prioritize, you know, what they're doing with their life and with their home. And I think they've had a chance to step back and like you said, appreciate what they have and not take things for granted.
Well, you know, whoever knew we'd be involved in a pandemic, and then when it first started and they were reading the demographic of who it hits first, I told my husband, I said, we're in the demographic. Who knew?
You still think we're young.
We do, in my head I am. And it really makes you stop and think, because you don't know, it was new, we don't know what was going on, and I have been more aware of food we're making, because everybody was eating at home and cooking,
Right.
and I would not have paid attention before. So, you know, you have to look for the silver linings, and I think that's part of it.
I agree. I agree.
Well, again, thank you so much. Thank you for everything that the Community Health Foundation does, clinically and for the community. And maybe we can talk when it gets closer to the celebration.
Oh, that'd be wonderful.
You let the community know what all.
Yeah, we can tell them a little more about Ron and about
Yes.
his message, and it's uplifting and it's motivating.
Yeah, it's always a great time. We'll have information at the end on how to get a guide, which is
Certainly,
free.
yes, happy to
And
provide those.
any other information you may need that you can get a hold of, and of course, to donate, which I recommend. And till we get to talk again, thanks.
Thank you, Michelle.
Thank you for tuning in to another episode of A Conversation with Villa Springfield. I'm Michelle Hemphill. Until next time, thanks.